Hey, it's Dr. Ko here, and I am a big proponent of ketamine, as you know, because I own a ketamine clinic and I'm all about the research and the evidence. But I do want to let you know there are reasons to not get ketamine infusion treatments. So I'm going to review some of those reasons in this video. Number one, lack of long-term studies. Although the evidence for ketamine is very strong, there's not a lot of data that are looking at patients several years out after their ketamine infusion treatments. So there's no 5-year, 10-year, 15-year, 20-year, 50-year studies for patients who receive ketamine treatments in a long-term period. And so this is something to consider as far as the longevity of evidence that's out there. Number two, there's uncertainty. So although ketamine can be effective in up to 60, 70, 80, 90% of patients in some studies and some clinics, it's not 100% effective. So if you're thinking, hey, if I do this ketamine treatment, it has to be 100% effective, or I don't want to try it, there's this uncertainty that it may not work for you. So be aware that although it can be effective, it's not 100% effective. Number three is the cost. So unfortunately, the vast majority of health insurance companies don't cover ketamine infusions because they consider it experimental or off-label. This means that you are likely going to have to pay out of pocket, and that can get expensive. So even if it does end up working for you, you might be one of those patients who needs boosters. And boosters can be, weekly, can be monthly, can be every, quarter. But it is possibly going to be a long-term maintenance cost for you. Number four, ketamine is considered off-label use for treating mood disorders and chronic pain syndromes. This means that there are no FDA trials that have gone through phase 1, phase 2, phase 3 for these specific conditions. Although ketamine is FDA approved, it's only for a very narrow area, meaning specifically in the operating room and emergency room for procedures and various operations. Number five, the risk of addiction. Although the risk is very low, I want you to be 100% aware that it is possible, but unlikely. And if you have a serious concern about addiction, please be cognizant of this. Number six is the risk of psychosis or mania or even schizophrenia. If someone has an undiagnosed schizophrenia, this could potentially trigger you to go into an acute psychotic episode and possibly even long-term. There's a reason that ketamine is known as a schizophrenomimetic, meaning that it can mimic schizophrenia-like mental conditions. So if someone has an underlying risk for this, I want you to be aware that this is very possible and unlikely, but possible as a risk when you get ketamine infusions. Number seven, ketamine can affect the liver, the kidney, the bladder. Now, we haven't seen this typically when used in the clinical setting, but it is reported that people who use recreational, chronic, daily high use of ketamine, this can occur. So if you already have issues with your liver or bladder or kidney, I want you to be aware that ketamine may not be for you and something to seriously consider avoiding. Number eight, ketamine can increase your heart rate and your blood pressure. So if you're someone who has already hypertension or has a serious issue with the heart rate going high, for example, postural orthostatic tachycardia syndrome, POTS syndrome, then ketamine may not be for you and something to avoid getting. Number nine, ketamine can cause psychedelic, non-ordinary types of reality. So this can be very amazing and enlightening, but at the same time, it can be very frightening. So some people have described a heavenly-like experience, but I have seen patients who describe a hell-like experience. So if this is a risk that you don't want to take, definitely do not get ketamine. Number 10, ketamine has a very interesting and colorful history. It's been known as a club drug, a horse tranquilizer, and when you tell other people about your ketamine treatments, they might make fun of you. They might have a lower opinion of you because of its history. And if you're someone who cannot tolerate having other people judge you or the opinions of other people are greater than the opinion of yourself, this might be a reason to stay away from ketamine. So this is 10 reasons that you may not want to get ketamine treatments. Ketamine is an amazing drug, but it's only a tool. And you really have to know this tool in and out. You have to do your research. You have to know the pros and the cons, the risks and the benefits, so that you can make a fully informed decision. Let me know what you think about this. Leave me any questions or comments below. Talk to you next time.